Mic check. Good day and welcome to another episode of Living Well with Adena. My name is Dr. Kataka and I'll be your host today. Thank you so much for joining us. As a reminder, we would love to hear from you. So if you have questions or comments, please insert them into the comment box below. We have staff that are on standby ready to get those questions to our wonderful guests. You know, it's been an interesting year and I know you've heard that on and over again. But today we want to concentrate on how we can best help our children and students get back to school. We have three wonderful guests that I'll introduce here in just a second that are going to talk with us today about how you can best prepare for that. They've been off from school, probably most of them since mid-March, and it's been a very, very long summer. And they've had to adapt. For some of those students, they may have been experiencing isolation and boredom and loneliness as they have had to adjust to new normals. Many of you are now teaching from home, as well as working from home, as well as not being able to do your normal activities. And so we want to be able to better understand how we can get back into normal routines, and most importantly, how to do that safely. It's very uncertain times, and even as of today, we're still not sure on how we're moving forward, whether it's with school, extracurricular activities, or sports. I'm pleased to present to you today three guests. Two of them I'll introduce right away as they are on the stage here with us. And then I'll introduce the third one a little later in the show. To start off with, I have to my right here, Dr. Amanda Jude from our family medicine practice. Welcome, Dr. Jude.
Thank you for having me.
We're glad you're here. We also have with her Dr. Gail Melnick, a pediatrician, also from Adena Family Medicine Residency Practice. Welcome.
Thank you so much.
Yeah, we'd love to have the viewers understand a little bit more about who you are. So Dr. Jude, tell us a little bit about your background and being part of the residency program.
So I'm a resident at Adena, part of the family medicine program. I'm originally from Orient, Ohio.
Awesome. And how long have you been with Adena now?
This is the third year of my program.
Fantastic. What were some of the reasons you went into family practice?
Honestly, I enjoy the patients. I enjoy talking to them and getting to know them and all of their family.
Awesome. Thank you. We look forward to hearing your expertise regarding how we can best prepare children to get back into school. Dr. Melnick, you're a pediatrician.
I am. I am originally from Pittsburgh, Pennsylvania, but I did my residency in Columbus at Doctors and at Nationwide Children's. Married a local boy, and I have been in the area for about 34 years now. I've been in practice for 33 years and came to Adena 2 years ago to be part of the family medicine clinic. And I am seeing patients privately with the residents, and I'm doing a lot of teaching and trying to share some skills I've picked up over the last 33 years.
We look forward to hearing about your 30 years plus experience.
Thank you.
Can you just take a moment and tell our viewers a little bit about what a pediatrician does versus perhaps family medicine?
Well, a pediatrician sees primarily infants, newborns, infants, children, and adolescents. I typically will transition my children to the family medicine at about when they graduate from high school.
Awesome. Well, let's start off with you and with the first question. So in a normal school year, when it comes to the health of our children, we focus on immunization. With COVID being here and perhaps child checks and sports physicals being a little interrupted, are immunizations still an important part of returning back to school?
Absolutely. Immunizations are especially important for children less than 2 because there are so many of them in the 2 and under range. And we have seen, especially at the onset of COVID, a big decrease in the number of our well visits. We need our children to stay up to date on their vaccinations. There is something called herd immunity, which is if the majority of children are vaccinated, it protects all of the other children that are either unvaccinated or under-vaccinated. And now we have seen a marked decline in overall vaccination rates. And so that leaves our population much more vulnerable to a recurrence of diseases such as measles, whooping cough. And so it's very, very important, especially with the uncertainty of the diseases that are around, to keep our children as protected as possible.
So let me make sure that we understand that correctly. What you're saying with herd immunity, that if a lot of children get the immunization, that actually protects some of the children who didn't get the immunization?
Right, because the overall disease rate will go down. If the majority of children have been vaccinated against chickenpox, then we just don't see chickenpox. And I personally have not seen a case of chickenpox in probably 15 years. As we see our vaccine rates going down, there will be more children starting to get infected, which will then affect the entire population of children.
Are there any particular immunizations of interest if someone, say, maybe around the 7th grade age or maybe a senior in high school? Are there any ones particular that a parent or guardian should ask for?
When we have children that it's either between ages 11 to 12 or entry into 7th grade, they will get a tetanus whooping cough booster, which is important because the last one they had was prior to going to kindergarten. So antibody levels are starting to decline. So that is very important to get. But the other that is very, very important is a meningitis vaccine. They are entering an age where their risk will increase for a type of bacterial meningitis that is actually very deadly. About 15% of all children that are infected will die, but the other 85% are at risk of blindness, deafness, loss of an arm, loss of a leg. So we do, prior to 7th grade entry, do the tetanus whooping cough and a meningitis vaccine. When they come in prior to 11th or 12th grade, we booster that meningitis vaccine so they have optimal antibody levels. And there is also another meningitis vaccine that is more specific for the very deadly strains of this type of meningitis. And we will offer that at age 16 with a booster at 17. If those children then go on to college and they are in situations where they're in very close contact, such as a dorm, it will protect them from this very, very deadly form of meningitis.
Thank you, Dr. Melnick. So in your experience, Dr. Jude, being a family physician, what do you or your staff do to help prepare a child to get an immunization? Some of them might be anxious. Have you noticed that or experienced that?
Some of them are anxious, and it's up to the parent whether or not how much they want to tell them ahead of time. We, of course, explain to them that it's going to help them, that we try to make it as quick as possible. Typically, we bribe them with popsicles.
Okay, gotcha. What are some common side effects that a parent might want to watch for after receiving an immunization? Or their child receiving an immunization?
It is a shot, so they may have some swelling at the site of the shot. They may feel a little achy or tired. Some of them do have a slight elevated temperature afterwards, so that's something to be aware of. Tylenol can be really helpful.
And of course, the parent or guardian could call and ask for if they have any questions after the shot, right?
Please do. Yes, most physicians' offices have someone on call to answer those questions after hours if you don't call during the day.
Thank you for that. So immunizations being one of those steps to get our children safely back into school. So let's talk a little bit, Dr. Melnick, about, well, what are some common health issues that you're seeing, particularly maybe related this time of the year?
Well, because of COVID, we have seen a lot of children who may be acting out a little bit behaviorally, and I think it is because their entire world and the structure of their world has been turned upside down. And we'll be talking a little bit later about, we've had a lot of children with anxiety, which might manifest as some behavioral issues. We've had children that are a little bit depressed because they just are out of their social network. They're fairly well confined to home. We have seen a decline in some of our infectious diseases that we typically see during the summer, but I attribute that more to our social distancing, the use of masks. So some of the viral illnesses that we see during the summer, we have not seen in great numbers right now. But I'd say the biggest thing when we talk to our children, we talk about their physical health, we talk about their mental health. And I think possibly because they may not completely understand what all has happened in their world, they're very confused and they really don't understand. They just want to get back into a normal routine, a structure with friends. And so they know a little bit more about what will happen from day to day.
Thank you, Dr. Melnick. And as you indicated, in a few minutes, we'll introduce our additional guests, and we'll have a robust discussion about mental health with children and the impact that COVID may be having on them and how to best prepare for school. As a reminder to the viewers out there, we'd love to hear from you. So if you have questions or comments, please insert them into the comment box and we'll address them. So Dr. Jude, as we get children back out of what seems like a 5-month summer, right? And so everyone's out of routines. What would be your recommendation about nutrition and school? Is it okay to grab the Pop-Tart out the door, or what advice would you give to parents about even before they get to school?
Well, we don't encourage Pop-Tarts for breakfast. Making sure that they have a good breakfast with plenty of protein and start the day off right, maybe with a cup of milk, is definitely helpful. Remember when you're packing their lunch to use things high in vitamins, vegetables and fruits, and try to give them packaging that they can open on their own, as we're going to try to decrease the teachers touching their lunches. So those are
I think
things
you bring up a good point, right? We're going to have some potential social distancing within our schools, and that would certainly help with. I've heard that a lot of schools are going to be going to a lunch within the classrooms. So thinking through about what would be easy for a child to eat yet nutritional would be very valuable. Thank you for that. Dr. Melnick, schools around Ohio are implementing different reopening plans. What precautions can your student take, or that you would want to review with students ahead of time to decrease their chance of COVID illness?
I think this is a good time, and some of the schools have already opened, but I think we really have to emphasize with the children that they need to wear their masks. And if they have another week before school starts, we might really want to try to get them into the habit now of putting the mask on, trying not to fidget with the mask, actually correct wearing of the mask, and get them used to good hand washing, and try to instill in them the social distancing. And I'm sure the schools will be doing their due diligence. They will disinfect surfaces. They will enforce social distancing. But for right now, it is getting a mask that is comfortable for the child and trying to enforce the actual use of the mask for the entire school day, along with very, very good hand washing.
Okay. So let's turn our attention to what parents, right? What can parents do, Dr. Jude, to help with preventing the spread of COVID with their students?
Well, just like Dr. Melnick said, these are children that are learning to wash their hands properly, make it into a game, or use your favorite song. You also want to keep an eye on your child's symptoms. They develop a sore throat or other flu-like illness, such as feeling achy all over, having a higher temperature, or coughing. Those are reasons to keep them home from school.
Awesome. We're going to invite our next guest on, and while we're making that switch here with our next guest, what would you recommend if should we take our temperature? Should parents take the temperature of their children before going to school?
Yes, it's a good idea to screen your children. They may not complain of feeling feverish, especially your younger children. Take their temperature, and if it's over 100.4, please keep them home from school and let the school know why.
Okay. What if your child has other symptoms? Perhaps they're complaining of a sore throat or signs of illness, like maybe a cough, headache, those type of things. Should they stay home?
If they're having a severe headache, if they're coughing or have a sore throat, keep them home from school and give your pediatrician or family doctor a call.
I'm sure you'll get asked this question a lot, and I think our viewers would have this question. What should you do if a child has been exposed to someone who has COVID-19, but they don't have symptoms themselves?
So if you've been exposed to someone with COVID-19, children can have some mild symptoms. So it's a good idea to keep them home from school, even if you don't notice symptoms.
Thank you very much. We appreciate that. I'm pleased to share with you our next guest. So our next guest is Dr. Kristen Collins. Welcome, Dr. Collins.
Thank you.
Dr. Collins is a child psychiatrist with the Adena Counseling Center, and we welcome her to talk a little bit more about the challenges that maybe we're experiencing with our students in preparing them for school. So Dr. Collins, first off, just tell us a little bit about yourself, where you're from, and how did you end up here at Adena?
Yeah, so my name is Dr. Kristen Collins. I am a child and adolescent psychiatrist. I also see adults. I just finished my child and adolescent psychiatry fellowship at Nationwide Children's Hospital in Columbus. And then before that, I did my general adult psychiatry residency at Ohio State University. So I've been in Columbus for the past 5 years. I just started at Adena Counseling Center in Chillicothe last month, and I'm very excited to be here.
Welcome. What
Yeah.
piqued your interest about specifically child psychiatry? There aren't a lot of you, are there?
Right. It is getting to be more popular, like more people are going into psychiatry, and I do feel like child psychiatry a little bit, but the need is definitely still there. So I first became interested in treating children back when I was a child myself. I was a nanny. I loved treating kids. Just learning about mental health in college and in medical school was just so fascinating. And then when I started residency, I really enjoyed treating the children and adolescents. I just feel like if you're going to treat mental health, the earlier that we can treat it, like particularly in childhood, the better that these people do long term.
Dr. Collins, I know myself. I've been stressed at times, right? And perhaps many of you viewers have been stressed as well, dealing with a lot of life changes over the last several months. Could you give us a little more insight into how the stresses may be affecting children, and if so, is it different than adults? And tell us a little more about that.
Yeah, so one of the biggest thing is children and teenagers, they thrive on structure and routine. I mean, adults do too, but particularly the younger ones. So with COVID-19 and not being in school this past spring, and then the summer, kids aren't involved in their typical extracurriculars, going to the pool, sports, things like that, and they're more isolated from their peers, extended family members, so less support. So I do feel that overall children and adolescents are struggling more with depression, anxiety during COVID-19. I think a big part of that is the isolation. So things that parents can watch out for in terms of like, hey, is my child struggling from a mental health concern, is to look for things like depression, anxiety. So the way that would look in a child adolescent is, the child may even come to the parent and say, hey, I haven't been feeling too good lately. But other common things would be the parent may notice their child is seeming kind of sad, down, depressed, less interest in things, sleep, appetite disturbances. They may be talking about blaming themselves for things, feeling really guilty, hopelessness, not wanting to be around anymore. They could be more irritable, easily frustrated. They might complain of like more stomach aches, more headaches, and a lot of like just fears, kind of anxiety, excessive worry. So mental health is definitely one of those things that's really hard for children and adolescents to talk about, as well as adults. But parents can often struggle even recognizing some of those symptoms in their children and adolescents.
Dr. Collins, we know that when we watch the media, or even perhaps in conversations with our own families or friends, there's a lot of strong emotion on one side and the other. Even as something along with masking in schools, lots of emotion on whether we should or should not do that. So how would you say, should we allow children to participate in that conversation? Should we limit how much they listen to the emotional debate? How can we help guide them through that?
Yeah, so in terms of just like kind of the social injustice and masks and all of that stuff.
Sure.
Yeah, so I think that definitely limiting the exposure is important. I don't think we should necessarily limit everything, because we do need to show them, some element of kind of like what's going on in the world. But definitely parents should limit that exposure, and parents should also be role models themselves. So if parents are finding themselves watching lots of TV, kind of getting engaged in these like really fiery arguments with people about stuff, the kids are going to pick up on that. And then they may be more likely to be anxious about it, get scared about it. So it's kind of a fine line, but I definitely think that the parents and the teachers can be really big role models with it.
Thank you. That is good advice. Sometimes children may not feel comfortable talking about mental health. There's a
Yeah.
lot of stigma around mental health. What advice would you give to get children or students more open to expressing how they feel, or that they might need some help or advice?
Yeah, so mental health is definitely a very hard thing for a lot of people to talk about. I do think the stigma is decreasing than it was, like less than it was years ago, but it's definitely still there. So I always talk to kids about like, hey, like mental health illness, it's similar to diabetes, to hypertension, like high blood pressure, needing to wear like contacts or glasses for bad eyesight. So there's a biologic component. So if a kid is nervous about talking to their parent or a teacher or a mental health professional about feelings of depression or anxiety, I usually tell them, like, if you think about if you had a friend or a sibling who was feeling similar to you, would you want them to reach out to you or someone who that they trust to talk with them about it? And then if you put yourself in those shoes, you may be more likely to reach out. So kind of just take your own advice.
I like that.
Yeah, and I always just tell them, like, it's nothing, to be really scared of. I try to normalize it. And usually that goes a long way.
I like that. Take your own advice. That's something I'll try to remember as well.
We all need to, right?
Yeah. Let's talk a little bit now about mask and masking. We know that many school districts, if not all, in the state of Ohio, are going to mandate the wearing of the mask. Dr. Jude, from your perspective medically, can you tell us a little bit about why we're, from a medical perspective, why the mask helps?
Well, masks are very important, not just in protecting yourself, but protecting everyone around you. I know all of us want to help the people around us and take care of our families and our friends at school. And if you do have symptoms that are mild and you're not aware and you sneeze or you cough, masks are very effective at stopping that from spreading to the people you care about.
Thank you. So easy for, I think, adults to understand that perhaps, but Dr. Collins, may not be as easy for, say, a fifth grader in school. And they might be feeling some peer pressure regarding that maybe they shouldn't wear a mask. What would you say to give advice to kids on how to handle the peer pressure, one way or the other, regarding the mask issue?
I like to frame it in terms of teamwork. So when we wear masks, we're not only protecting ourselves, we're helping ourselves, we're also protecting and helping others. So I say, like, you're also helping your best friend, you're helping your best friend's newborn baby brother, your best friend's elderly grandmother, people you don't know. So it's like really a teamwork. And sometimes kids can kind of understand that because they're often used to playing sports or dance recitals where they are engaged in teamwork. Other things I recommend, especially for the younger kids, is to, actually really the whole age range of kids, is to let them pick out their own mask. Because some kids, some kids want something that's very colorful, lots of characters, kind of flashy, and then other kids would feel much more comfortable with wearing kind of a plain, neutral colored mask. So whichever they feel more comfortable with. Some kids can even use the masks as like part of their style to the rest of their outfit. And then for the younger kids, I recommend that the parents incorporate the mask into play. So if they're playing a doctor at home with their stethoscope, their doctor bag, they can have the doctor person wear the mask and the patient person. And then really especially the younger kids, if they have a favorite stuffed animal or a favorite doll, the parent can also have a mask for them. So really just try to normalize it, have it be a part of their daily routine. And also another really important thing is to have the parents model wearing masks.
I really like that. I like the idea of letting them pick out their own mask.
Yeah.
Gives them a sense of control.
Yes.
And also perhaps some normalcy. You use that word a lot, normalize.
Yeah.
So that's a great idea. Thank you for doing that. So some questions that are coming in here. I'm nervous about sending my child to school, but he wants to go. What can I do to be confident he's safe? I'm going to ask you, Dr. Jude, what your thoughts there are.
Well, I think all of our schools, our teachers and the administration are working really hard to put policies in place to change how they do normal activities of life. I would ask about those and become involved in what your school has going on. Also make sure that you educate your child on why we're doing this and wear the mask so that they can see you being comfortable with it as well.
All right, thank you. Dr. Collins, turning our attention, we've talked a little bit about that they'll do all of their learning virtually initially, maybe for the first couple weeks or a couple of months or perhaps even the whole school year. what can they do to help with socialization and still allowing that natural growth of their child?
Yeah. So the natural like social development with peers. So definitely, I mean, increase whatever interactions they have with peers. So whether it's via cell phone, texting, if they are getting together for face-to-face interactions, like if parents feel like it's okay, safe, and everything for them, I would definitely still continue to do those. If they're just as much interaction as they can still have with them. And then another thing is if they are doing the schoolwork from home, to have a lot of structure at home. So set the school day up at home similar to how they would at school, like have them get up at a certain time every day, have lunch at a certain time, finish the school day at a certain time, have dinner at the same time, bedtime at the same time, things like that. I know I talked about structure and schedule before, but it's just so important, not only for the kids who have depression, anxiety, and you want that sense of control, but also those kids with ADHD, because they really, really need structure, which they got a lot in school, but definitely at home, it's a new kind of structure you got to set.
I'm going to tune into your adult psychiatry training for just a few minutes. So particularly for those parents who have their children at home, they're doing all of their work virtually, or they're normally homeschooled, what advice can you give to the parent who may need a break as well, right? Because they're working from home from the kitchen, they're 2, 3 students are in a different room, there's not the routine breaks. Any advice there?
Yeah, so there's definitely a lot of things that adults can do even when they have really, really young kids at home and if they can't like get a babysitter. So if they are able to do any like workouts inside their house, they don't need to have machines. They can use jars for like lifting. They can buy other like types of like small, cheap exercise equipment. Definitely recommend if they like meditation, yoga, they can do at home. Still being able to talk to their own friends, making sure the parents get like enough sleep at night, that they're eating well. Those are some of the big things. If they are able to get outside of the house at times, even going for walks in the neighborhood would be helpful. Definitely parents taking care of their own physical and mental health so they can better help their families.
One more question around parents then, if you don't mind, Dr. Collins. Those parents that might be anxious, right? Their son or daughter or niece or nephew, whomever is going to school, and they're just anxious about COVID or perhaps about the quality of learning or social distancing or the bus ride. What can they do to decrease their anxiety or worry?
So if the parents worried about it, so I would recommend, especially if they have any friends who aren't as anxious about it, like just talk with them like, hey, how, were you ever worried about this? How did you kind of get through that worry? Even talking with their child about it, because if the child isn't as anxious about it, maybe the parent may have something to learn from that. And I would just say, even talking with the child's school, their teachers, like, how are you keeping the classrooms clean? How are you keeping everyone safe? Things like that. So I think oftentimes the more education a parent can get, the more they can then help calm some of their own anxiety.
Is it safe to say, Dr. Collins, I'm hearing a theme that communication really is important, just talking about it, right? And getting that out in the open is very valuable.
Yes, definitely.
Good advice. Thank you so much. So what are, let's say, Dr. Jude, particularly in the younger age, it might be a challenge for an adolescent to wear this because of the complaining, but it might be a challenge for a kindergartner to wear this. Any advice that you would give to parents about how can you get your child used to wearing a mask?
I think if you could make it into a game, that's the best way to do it. Like you talked about introducing it to their stuffed animal. I've heard of some children that think they're going to become ninjas or any other fun activity for them. Practice now before they go to school. So when you're in the home, put the mask on them, let them get used to it a little bit at a time. That way you don't have to start masks for a full school day on the first time wearing it.
So if I hear what you're saying, as the bus pulls up on day one, that's not the time to put the mask on the first time.
No, they should be exposed to it earlier and try to make it playful.
Okay. So Dr. Collins, that makes me think of particularly younger children, first day of school. There may be some anxiety. It's the first time they left home. That's naturally anxiety provoking. But now people are masked. There's plexiglass. There's the social distancing. How can we help those children kind of acclimate better given the
Yeah.
new restrictions that might be in place?
Yeah, so I definitely, kind of going back to the parents being the role models, I think is a huge thing. Introducing the masks weeks or as much time as you can before that. Even doing like a drive-through, I would say, kind of like, so even before the first day of school, having them dress up in maybe whatever outfit they want to wear that day, wear their mask, have them walk to school. So just practice it beforehand. And again, just kind of talk about how much it's helping them. It's helping like their best friend. And if there's any TV shows or cartoons that the kids are wearing masks, like definitely let them watch that and then have conversations about it.
Okay, so pick their own mask,
Yes.
start early in wearing that mask, and then talking about it.
Yeah.
Great advice that you have. So a question that's coming in, Dr. Jude, will ask you, my teen has been much less active and has gained a little weight since COVID and being home. How should I get them to move more and not eat junk food?
I think that's a struggle for all of us. Trying not to keep junk food in the home and having healthy options instead of those Cheez-Its. Maybe try some carrots instead. And asking them what foods they are willing to eat is pretty much the first step to trying. Also, outside is safe as long as you can keep a social distance. Don't stop exercising. Go for a walk. We're very lucky to live in Southern Ohio with so many great trails. So encourage them to do that. And most of the time, if you're biking, you're keeping 6 feet away. So that's a safe activity as well.
Okay. Another question for you, Dr. Jude. With COVID at the forefront, and we talked about well visits before, what can a parent expect from that well visit?
So all of our offices are working really hard. Each office is different, so call to see. Some will have you stay in the car and call you to come in when they have a room available. That way you're not spending time in the waiting room. We also try to encourage patients that do have symptoms of COVID to be roomed separately. That way your children are not exposed to that. You may expect to wait a little bit of time in the room instead of in the waiting room, but please call each office to see what they're doing.
Okay. And what, with well child checks with adolescents, do you do that with the parents in the room, not in the room? How does that work?
Really both. So we started off with the parents there and part of the team. I like to ask the parents to set out for a little bit to talk about subjects the child or teen may be more shy about talking, and then bring the parents back in to kind of summarize what we've gone over.
Okay, thank you, Dr. Jude. Dr. Collins, in 2019, Adena participated in what's known as a community health needs assessment. Interesting statistics came out of this health assessment. 38% of the respondents believe depression and anxiety is at the top of the community health concern, and 41% saw mental health education for children as a needed health education topic. I'm a little surprised by those statistics. Dr. Collins, what are your thoughts where we stand in the region as in terms of mental health needs?
Yeah, so I definitely think that mental health is a growing concern, like not just in this county, but also all over Ohio, all over the nation. I do think that the mental health stigma is decreasing somewhat. People are talking about it more, but it's definitely still there. And I do feel like that during the COVID-19 pandemic, mental health is being talked about more. There are getting to be some more resources. People are sometimes still having a hard time getting in because providers are often working from home, or maybe just less resources and stuff. So, and I think I mentioned this before about just the earlier that we can treat mental health in someone, the better they're going to do. So that's also why I went into child and adolescent psychiatry, because I feel like I can make so much of an impact in helping them before some of the mental health needs just become so severe. But it is definitely important to remember that you can seek mental health treatment at any age. There's always something that we can help with.
So, Dr. Collins, we've talked a lot about COVID and the anxiety and around COVID, but we also know that adolescents in particular experience other challenges with mental health, particularly in our region with illegal drug use, vaping, those types of activities. How can we get, if we determine that a student needs help, where can they go? Who can they contact? Who should they reach out to?
Yeah. So often the easiest way to get help is first, to talk to your parent or your teacher, and then that your parent or your caregiver can then reach out to your primary care provider. So whether it's someone in family medicine or a pediatrician, they can make an appointment with them, or give them a telephone call and let them know what's going on. And then at that point, that primary care provider can either help them or direct them to the next steps. And the next steps may be someone like myself in psychiatry or one of the child and adolescent therapists.
Well, so that's an important point you bring up, Dr. Collins. It's not necessarily directly going to child psychiatry. They could reach out to a family physician, a family nurse practitioner. Is that correct, Dr.
Yeah, we often refer patients to psychiatrists and psychologists. We also work closely with a lot of the recovery programs in our county and trying to find the best resources that fit that patient.
So in the well adolescent exam or well child exam, do you actually ask questions regarding tobacco abuse, illegal drug use, drinking, those type of
Yes,
things?
we often ask teenagers about if they're smoking, if they're being pressured to use any kind of drugs, and encourage them to come up with what they'll respond with and say. That way, the first time they're pressured, they're not surprised.
How do you handle a situation where perhaps, let's say, a 16-year-old comes in the office and says, I have a struggle with alcohol, but I don't want to tell my mom. How do you handle a situation like that? I'd be curious to hear actually from both of you. How does that work, and what you recommend?
I think exploring their fears about telling their parents and about how they're using alcohol is the most important step. Most of the time, if we're able to talk it out, the child becomes more comfortable with us helping them tell their parents. That's been our experience.
Yeah, I would definitely agree with that. And I've had plenty of times where I have that same situation in my office. The kid actually wants to tell their parents. And then oftentimes we'll bring the parent back in and the kid will even tell them right there. Sometimes just having that extra cushion, like myself or another provider in the room, can be helpful for them. And the vast majority of the times the parents are actually respond very well and very opening and really want to help. And it just opens up the lines of communication for the family.
Thank you. So sometimes they just need that help. They want to, they don't know how to. Is that what I'm hearing? Fantastic. Okay. We have just a couple minutes left, and so I'm going to just kind of finish up here because you've been very, very helpful. Dr. Jude, any last minute advice that you would have to parents regarding how do you determine if your child is just sick? Because they normally get sick, right? You get the flu, you get a mild cold, you might have some fall allergies, or they have COVID, and it's how are we going to help navigate that over the September, October, November?
That can be really tricky, even for those of us who do it for a job. So I would say don't do it alone. Please call and ask for help. Whether it's triaging the child over the phone or having them come in for a visit. We're doing car visits for children that are sick where we go out to you and listen to the child there.
Oh, so tell me a little bit more about that.
So that's something we started to try to prevent having our sick patients come into the building with the well children. Is in our residency clinic, the resident will go out, get the vitals, talk with the parents, and do an exam to try to decide if this is a good child to have them be swabbed for strep or flu, or sending them to one of the urgent cares that does outpatient COVID testing.
Thank you. I like your statement, don't do it alone. Yeah, we're a valuable resource. Thank you. So you mentioned car visits. Dr. Collins, in the last minute or so that we have, has your practice changed with technology on how you counsel folks and meet with individuals?
Yeah. So I just started at Adena Counseling Center last month. So I know that right before that, around, I believe it was sometime in the spring, everyone was working in clinic. And then with COVID-19, they started working from home and seeing the children, the teens, the adults via telepsych. So they were able to see them on a screen or else on the phone. Now most of the psychiatrists we're working in clinic. A lot of our patients we're seeing back now face to face. Everyone's wearing the mask, getting temperature checks, being the 6 feet away from each other. We are still seeing some people via telepsych, just whoever's more comfortable with that, whatever their preference is. So it's kind of a mix of both things.
So there's different options for your patients.
Yes.
That's fantastic.
Yeah.
Thank you so much to our guests. We're pleased to have the three guests with us, and I want to personally thank again. We have Dr. Melnick, who is off camera, who is the pediatrician from the Adena Family Medicine Residency, so thank you to her. Thank you as well to Dr. Kristen Collins, who is Adena's child psychiatrist here. We're glad that she's been with us for the last month and look forward to having her provide her services in the region. And last but not least, Dr. Amanda Jude, who is a family medicine resident at the Family Medicine Clinic at Adena. I want to remind all of you, I like her last remark about don't do it alone. And so Dr. Collins, Dr. Melnick, and Dr. Jude all stand ready to help you, particularly if you're struggling with your children going back to school. The best way to find and contact them is through adena.org. Another option that you have is calling 740-779-FIND. Again, that's 740-779-FIND. And if you need a pediatrician, Adena Counseling Center, or a primary care physician or nurse practitioner, they stand ready. Thank you for joining us, and we appreciate you. And we'll see you back again in 2 weeks for another episode of Living Well with Adena. Thank you.